One of the things that is critical is, are you going to give a block on a lower molar? The statistics show that dentists miss about 9 or 10% of their blocks. Here's our philosophy in the office. We use Septocaine. My go-to anesthetic is Septocaine. Septocaine is what we use 95% of the time, because I can typically infiltrate with Septocaine and get profound anesthesia on every tooth except the lower, second, and third molars, in which case I give a block. So my number of blocks are small. So yes, for first molars, doing root canals, lower first molars, forget the uppers. We get them numb, obviously, with an infiltration. But lower first molars, I typically can get them numb with a Septocaine infiltration. If you have a hot tooth, you can go ahead and give it STA, or you can go give it a PDL, but we're still doing it with Septocaine. But second molars, it's a little bit questionable, so I'll still give a block, and I usually do that with lidocaine or carbocaine. So Septodont makes Septocaine. In Europe, it's called Septanest. It's been around for a while, yet a lot of dentists use it, but a bunch don't. I think about 40% of dentists use Septocaine in the United States, which means 60% don't or never heard of it. It's an outstanding anesthetic to get people numb, and it is my go-to. You start using Septocaine, you won't turn away ever again. So it gets people really numb really quick. The breakdown's pretty quick in most people. So we'll use it really only for infiltrations, operative, oral surgery, endo, even implants when they're placed by my surgeon, always using Septocaine. There's really no contraindications to it, except for the fact that we typically do not give mandibular blocks with it. Now, the research is very mixed on whether you can or can't, but a number of years ago, research came out to show that maybe giving a block was, you could get some paresthesia with Septocaine, so we just stay away from it. We don't do it. But here's a study that was done in 2011 that showed the pulpal anesthetic efficacy of Septocaine, which is articaine, versus lidocaine in dentistry. And I'll read the red at the bottom is research evidence supports using articaine versus lidocaine for achieving pulpal anesthesia when the infiltration mode of administration is used. It's premature to recommend articaine for mandibular block anesthesia in cases involving irreversible pulpitis, but infiltrations really preferred over lidocaine.